Hi, Dr. Shivani is here. We are going to discuss about Medline Academics Infertility course in this video in detail. Starting from what is their fee structure, what was my take to join this course immediately after residency, what they are going to provide us in this 1 year whole program, how their site interface look, how to approach this course, who will benefit most from this and who will not benefit from this course.
Their fees is 6,50,000. In that they are going to provide us with the proper university recognized fellowship certificate with 50 ohm pickup certificate. So coming to outside center, most of the centers charge around 3 to 4 lakh for only ohm pickup certificate. Ohm pickup certificate is required to practice as an independent IVF consultant according to ART law. What was my take to join this infertility course immediately after residency? Firstly, I was getting some exposure during my residency as well. I was working in Sion Hospital where level 2 ART center is permitted, but level 1 ART center is under full-fledged working. We used to evaluate a infertility patient, and most of the patients are referred from periphery who are not affording or very complicated IVF patient were very difficult to manage in private hospital. So those patients we used to evaluate. We used to get to see lot of reports. We used to see around 30 to 40 patients daily. Quite a good exposure of infertility I feel during residency. As a part of infertility workup, you should be knowing about saline sonography, DHL-scopy. So we used to do that as well during residency only. I have seen lot of cases during residency of this DHL-scopy SSG. In my SRship, I have joined my SRship in Sion only. So during SRship, I used to get those things. Like I used to do DHL-scopy, I used to do SSG. So that was quite useful for me. 6,50,000 is a quite big amount to pay. So what was my financial take? I have done my systematic review. See, I used to earn 1 lakh from my SRship, 50,000 from my evening OPD. So average income was around 1,40,000 after taxes. Of that, I used to pay 50,000 for this fellowship program. 80 to 90,000 used to stay in my pocket. So that was my saving account. This is the advantage of this course. Most of the infertility program are paid programs, and along with that, staying there for 1 whole year, not able to do your obstetrics or gynecology practice, and you will be paid around only 20-30,000, which is a very less amount to have good living. So I decided to go for this infertility course because that is one of the reasons that I want to do my obstetric work, gynec work along with infertility work, not only infertility work. Coming to who will get benefited most from this program, consultant or senior practitioner who are already having their own hospital, own OPD will be benefited most because you don't have to leave your hospital or your practice for the fellowship program. You will be getting that knowledge at the comfort of your home or your practice, along with managing your routine obstetric gynecology patient. You can start your level 1 ART center and slowly upgrade it to level 2 ART center according to your confidence of the